I'm with Professor Colleen Moore, who is an instructor at FSW Nursing College, and she's going to explain to us how to be a successful nursing student. So our first question is, can you give us a brief overview of nursing program?
Well, we teach in the ASN program, and we have a program that goes from the ASN, a 2-year program. We graduate, you take your board, and from there you can go on to our BSN program. You do have to have your license first to continue into our nursing program, our BSN nursing program. Whereas there are other programs where you could just go in at a BSN entry level and go through your 4 years and obtain a BSN. But this works better for most of our students because our students are of all age groups. We have from right out of high school up to, I think the oldest student I've had is about 62 years of age. So with our older population and working and trying to support themselves and their families, going through the 2 years plus their prereqs takes about 3.5 years total anyways. And then once they get out, they can start working as an RN while they are obtaining their BSN. So like I said, our program is a 2-year program. And what was the rest of the question? I kind of forget now.
What kind of things do you have to prepare for to get into the nursing program?
Well, you have to have a good GPA. You have to remember that nursing programs, just like all of our healthcare profession programs, are very competitive because these positions in these classes prepare you to enter the workforce, whereas some of the other programs at FSW prepare you to go on for your for your bachelor's degree so that you can obtain a job. This puts you into the workforce. So they're very competitive, and there's only so many seats. So you have to have a good GPA. I think the GPA has to be 2.7 or greater. You have to pass the TEAS exam. You now have to go through an interview process to enter our program. So the TEAS, the GPA, the interview process, and you have to have completed all your prereqs first before you can get into the program.
Okay. And how are students successful that you're teaching now that are in the nursing program?
How are they successful? Well, first of all, a lot of the students that we have are successful students to begin with. They have a drive and they want to succeed. And then we take the best of the best that are applying. Oftentimes we have to turn students away from our program. So that in itself lends to good academic achievement. On this campus we have 3 full-time faculty that teach the program. We have a clinical coordinator for our simulation labs and our clinicals. And we have Wendy, who is our clinical assistant. And we are all available to our students at all times to help them through any difficulties they might be having. They also they have a student nurse association, which a lot of them are very active in. Also, we encourage our students to participate in study groups, mentoring program as well. So when you enter into the program, we assign you an older student as a mentor that you can use as somebody that can help you relieve test anxiety, decrease the amount of stress that you're having, somebody that you can use as a sounding board, and somebody that's already gone through what you have gone through, so they understand what you're feeling, how you're feeling.
Okay, so you had mentioned earlier that the teacher or the instructors lend themselves to the students as often as possible. How do you personally help students achieve well in the program?
Well, we have, our program is a lot of active learning. We do some lecturing, but we also do a lot of class activities, because what we need is to teach our students the foundation of nursing practice, but then also how to apply it when they get out into the profession. So if they're having problems with their application piece, we will put them into a simulation lab and have them do extra practice time there so that they're carrying forward the didactic piece into the actual practical piece. Also, we will review tests one-on-one with our students. Our tests are different than what most students are used to as far as testing goes, because they are all application and assessment type questions. So we don't ask black and white questions like most students are used to. We ask a scenario type question, and then the answers, the student has to apply what they have learned to that actual scenario to answer the question, so it's a bit difficult. So we have many resources for that. We also have an academic review board, review committee, so if you don't pass the test, or if you're not coming to class prepared or on a regular basis, we do write out a form, sit down with you, talk to you about how you can go about improving so that you can maintain the 77% average that we require for you to stay in the program. And then that goes to the academic review committee. They look it over. They agree with what our plan is for success, and we go from there. Unfortunately, some of our students obviously don't succeed, and then the academic review board is the one that will come up with what strategies we could use, or do they have to step out of the program. Some people are not cut out to be nurses. They don't realize that till they get in the program, but not everybody can do it. Our program is very rigorous, very challenging.